Thank you, Steve. It's a pleasure to be here. I want to thank my former Congressman, Bob Walker, my predecessor from the 16th Congressional District, for inviting me here today. We did have 26 bills. Actually, there are 30 bills, but we combined them into 26 that were signed into law that came through our Health Subcommittee last session. One that you would be familiar with is track and trace, compounding pharmacies. Some very good legislation, but this week we had the first invitation to the White House for a ceremony for the signing of the SGR, the Sustainable Growth Rate. So it's a good week for healthcare, but healthcare represents over 17% of our economy, and by the beginning of the next decade, it's projected to be more than 19%. And much of that spending is regulated and directed by the government. And that's the way it was before the Affordable Care Act, affectionately called Obamacare, and the President's health care law made it even worse. I say worse because I believe many of the biggest problems in the healthcare sector are the result of government intervention, and that they can be cured, not that they can be cured through bigger government programs. We need market-based alternatives. There's a role for government in providing a safety net, in protecting consumers, in funding basic research. However, as we've seen, government price fixing and controls are doomed to failure. Open-ended entitlements, likewise, are doomed to failure. They need reform. We must act to save and strengthen some of them. Government regulations and government bureaucrats can't replace the market. And whenever we try to replace the wisdom of the market with the wisdom of the government, we're setting up ourselves for a fall, in my opinion. Now, on my side of the aisle, the Republicans are not immune to the temptation of using blunt government instruments when it comes to health care. In fact, we've spent more than a decade trying to unwind one created by former Speaker Newt Gingrich and President Clinton in 1997, called the SGR, the Sustainable Growth Rate. And the SGR was supposed to hold down Medicare growth. It passed through a Republican Congress. It was signed by a Democrat president. It was a blunt instrument, and if Medicare spending was projected to grow too much in a given year, doctors' reimbursements would be cut to save money. And this year the cut was 21.2%. After March 31st last year was 24.5%. And the reality is that Medicare reimbursements don't track with the market price of providing care to begin with. Cutting reimbursements would have led doctors to rush out of providing Medicare coverage. It's just a matter of economics. And so rather than see Medicare doctors ration care to Medicare patients, Congress forestalled the cuts 17 separate times, called patches. And often, instead of cutting, the SGR patch legislation would increase reimbursement. Sometimes the patch would be paid for with other changes in Medicare. Sometimes it wouldn't. It was a haphazard way of legislating, and it went on for over a decade. Some of the patches were short, some were a year long, 17 times. So when I became chair of the Health Subcommittee on Energy and Commerce 4.5 years ago, I made one of my goals to end the patchwork legislation and get a permanent fix to the problem, repeal and replace the SGR. Took us 2 years to develop in talking to the doc groups and all the about 75 specialty societies. But we developed the policy, and In last session, we moved the bill out of the committee 51-0. It was a bipartisan piece of legislation. We worked with our friends on the other side of the aisle and in both chambers. And there was real consensus on the policy, but not on the pay for it. As you know, our rules, we have to pay for it. So we passed it in the House overwhelmingly. It died in the Senate. This session, Speaker Boehner and Nancy Pelosi started working together on the pay-fors. And it took a lot of negotiation, but the House finally passed the bill just a few weeks ago, 392 to 37, and in the Senate it passed last week 92 to 8. So very strong bipartisan support, and the President signed it. And earlier this week, the President had us over to the Rose Garden for a little ceremony to celebrate this achievement, bipartisan achievement that will benefit our seniors and our doctors who treat our seniors. So I'm proud of what we were able to accomplish on the SGR deal, but this is far from the kind of measure that is needed to ensure that Medicare will be there for our children and grandchildren. Medicare is still an open-ended entitlement that is projected to explode the federal budget in coming years. If we don't do something about it, government health care spending will crowd out pretty much every line item in the budget, including defense infrastructure, housing, education, most of the things we think of when we think of the federal budget. Now, most of my friends on the other side of the aisle simply aren't interested in reforming an entitlement program that they have created. In fact, they had promised doctors that the SGR would get fixed with the Affordable Care Act. That promise was dropped when the price tag was too large. The fact is that it's easy to create new government programs, very hard to make existing ones actually work and actually stay within budget. And I might say the folks on my side of the aisle have a track record of reforming health care in creative ways that have helped hold the line on spending. We created the SCHIP program, the state children's health insurance program. We reauthorized that for another 2 years in the SGR deal at the higher rates, by the way. Why? Because it is less expensive for the federal government to keep a child on SCHIP rather than put them into Medicaid or onto a subsidized Obamacare plan, and the quality of coverage is better than with the other two options. And over time, of course, some of these reforms have been changed. We designed SCHIP for poor children without insurance children. Now in some states you've got more adults than children on CHIP. Poor, now you can make $90,000 family of four and get SCHIP coverage without insurance. About a third of the children coming on to SCHIP are coming off a private plan. So it's been changed in some ways, but that initially was a Republican idea. We created Medicare Part D, which actually came in under budget. It's grown far below the rate of inflation. It's quite popular with seniors. In the same legislation, we created Medicare Advantage programs that give seniors new options for their care managed by private insurance. And again, this is very popular. And although they've attempted to cut it a couple of times, we have seen the public so supportive that this year we ended up increasing it, I think, 1.25%. And these plans are popular, especially with low-income seniors. And participants have better health outcomes. We created health savings accounts, another program that people can save for their own health care needs. So we have some track record as far as health care reform. The Affordable Care Act, however, in my opinion, has been really a disaster for health care. It's driven the cost of care up for tens of millions of Americans. It's driven the cost up for businesses. It has added to the government deficits. Yes, some people have health insurance now, but it's such an incredible cost and deductibles that we have to wonder whether it would have been better just to write checks to people who didn't have coverage. The Affordable Care Act is an extraordinarily complex attempt to solve the problem of expensive health care coverage. And the reality is that it doesn't actually bend the cost curve, the biggest problem of all. However, we may get another shot at some real reform given the outcome of the case before the Supreme Court now, King versus Burwell. That'll come down on June 26. We can apply what we have learned with previous successful reforms, hopefully give at least some states an off-ramp for Obamacare. House Republicans will not stand by and watch millions of Americans lose health care insurance. We will be ready to act with legislation when the court hands down their ruling. In fact, we put out some op-eds. We had the three chairmen of the standing committees, Ways and Means, Energy and Commerce, and Education Workforce sit on the front row in front of the justices. We've tried to get coverage on our alternatives. We will introduce that alternative before June 26 so we can have it scored in the baseline. And we will have 3 or 4 months to get that passed. But basically, we will use if they strike the language, the subsidies for the federal exchanges, because they had put language in the Affordable Care Act to incentivize state exchanges by providing subsidies for those. And when 2/3 of the states didn't provide that, then the adjustment was made by the administration to provide subsidies for the federal exchanges in those states. We'll take that money that was used for those subsidies, target it with refundable tax credits to the 8 million people who lose their coverage, and we'll cover people, of course, with pre-existing conditions. Our legislation actually predated the Affordable Care Act. We have a different mode. We use high-risk pools, state high-risk pools. We funded our program. We warned our colleagues on the other side that they had underfunded the PSIP federal program for pre-existing conditions with only $5 billion, and they ran out, in February 15th of that year. So we will do the low-hanging fruit, like cover pre-existing conditions, cover kids until age 26 on their parents' plans. The only difference in our legislation, which predated the Affordable Care Act, we said dependents until age 26. But we will do those with some other market-based programs and ideas for reform. Our plan has 2 parts. We'll end the extensive federal mandates created by the Affordable Care Act and give choices to the states and individuals and families. Second, we'll create a new way to support Americans' purchase of insurance. And first, I think we have to create real choice and competition. And the Affordable Care Act made an already expensive service even more costly by creating a host of new mandates. And any state that does not want to participate in the Obamacare exchanges should be able to opt out of those government mandates and create a program that works best for their residents. And this, for example, would let states get rid of the burdensome employer and individual mandates. Our plan would also help drive the cost of insurance down by giving Americans choices that work best for them. We should allow Americans to shop across state lines for insurance. Right now, if you want to buy insurance in Pennsylvania, you've got to buy from one of the companies in Pennsylvania. You can't go to another state. I mean, if you want to buy car insurance, you can go to Lizard, but for health insurance, you've got to you can't cross state lines, and we would permit competition across state lines. We would permit pooling across state lines. There are vast groups of people, if they pool, could bring down rates. We'd permit portability across state lines, so you own your own health insurance plan, take it with you from one job to another, one state to another. And we would do, things like medical malpractice reform, increase HSAs. We'd treat the individual like a company is treated, with the same kind of deductions, incentives, so that individuals could be encouraged to provide their own insurance. Secondly, we will help people get the coverage they need. Our plan would change the tax code to help individuals buy insurance. Congress can also consider additional ways to help Americans get coverage, like empowering states to draw up innovative coverage solutions best tailored for their residents. And should the court rule against the president, he will then have a choice. He can work with Congress to improve health care, or face seeing millions of people suffer the consequences of providing solid health care reform. So hopefully we can reach out and negotiate some changes to the system if and when that occurs. Now, the President and the Republican Congress have had our share of differences, but there is something I think we can work together on, and it's called the 21st Century Cures Initiative that is being led by the Energy and Commerce Committee Chairman Fred Upton, and in a bipartisan manner. Last year I held 12 hearings, and we had about 12 roundtables with stakeholders from R&D researchers, institutions, agencies, doctors, hospitals, even venture capitalists. And what we're trying to do is identify the barriers of getting cures to the patient and overcome those barriers to get cures to patients faster. At the hearing I had in Lancaster County in my district, we had Francis Collins, head of the NIH. We had Commissioner Hamburg from the FDA. We had the ranking member. Again, this is bipartisan. We're working. We met this week with our colleagues to talk about the second draft. We put out one discussion draft earlier this year. There were some gaps in it, but we'll be putting out another draft next week, and we'll have our first hearing on that next week on Friday. I'll chair that hearing. So it's on a fast track, and in this age of increasing technology, precision medicine, genomics, all the increases in improvements in innovation in healthcare, this is very timely, and it's something that we can work together with our friends on the other side of the aisle, with the president. So we're hopeful that by June we'll have a vote on that. It's a very broad effort to treat to have more treatments and cures for more diseases. There's something like 10,000 diseases, only 500 treatments, 7,000 rare diseases, and we have a vast government health apparatus, but all too often it works against even itself. You look at medical devices, and all the venture capital now for medical devices going over to the EU. You can go there and get a medical device in half the time and just as safe. If you look at some of the studies, we would like to overcome the risk-averse nature and some of the barriers to get medical devices and drugs to our patients in a more timely manner. And so we're working with the agencies to evaluate and negotiate, try to get some of these changes. We're spending billions both driving medicine forward and all too often spending billions to hold it back. And no doubt we need safe drugs and medicine, but a process that is unpredictable and slow does not, make us safer. And we found that in many instances our process is longer, more complex, more expensive than other places in the world that have, and we have no better outcomes. So that's an initiative that I think is very important if we want the U.S. to continue to be the center for groundbreaking research, keep our pharmaceutical and our medical device industries, which I consider gems in the crown, here in this country. We have to do better at every stage in the process of developing cures. And with this initiative, I think we're close to another major legislative breakthrough. The President even telegraphed his willingness to work with us by including a statement section on precision medicine initiative in his State of the Union address, and by the end of this month we should be able to see how those negotiations go. But I think they're going very well at the present time. But it's mostly legislative at this point, and agency talking about our language. But it's my hope that by the end of the summer we will get something through the legislative process. There's a lot of work for Republicans to do in order to gain the public trust needed to take on big health care problems, and we need to talk about saving and strengthening these entitlement programs. I think we're well positioned to do that because we do, as I said, have a track record and have a vision for a freer country and less expansive government. So those are a few thoughts on the status of what is happening in Congress. We always appreciate your engagement, involvement, your advice and counsel. We look for that, and we will continue to work with you. And again, thank you for what you're doing. I briefly read your report. I will read it more intently, but you've got some wonderful ideas in this, and we look forward to working with you. And again, I want to thank my predecessor, Bob Walker, for inviting me to be here. Sorry I can't stay. You know what the schedule is on the Hill, but it's a pleasure to have been with you today. Thank you very much.